We could be close to reaching a new low in the fight against measles. Yesterday, the New York Times reported that the strain of measles responsible for an outbreak in Texas is now linked to cases in other states. And if they continue into January, the virus will no longer be considered eliminated in this country. Tonight, Kent explains the level of concern in our state of Minnesota and a new surveillance strategy that offers some hope.
The medical director of the Children's Minnesota Primary Care Clinic in Minneapolis calls the state of measles prevention
just incredibly discouraging.
And Dr. Chase Shudak says the feeling starts right here because while the national MMR vaccination rate for kindergartners has slipped below herd immunity status over the years, Minnesota's rate has dropped off even faster, now among the 5 worst in the country.
The real problem that I think we've noticed is that more and more families are coming in already having made a decision. They are not curious regarding kind of what our experience is, what the data that we've seen is.
It's gotten so discouraging that the biggest emerging hope for combating outbreaks may come from our toilets.
Wastewater is one piece of that puzzle. It's one indicator of what's happening in the population.
Stephanie Meyer is a senior epidemiologist for the Minnesota Department of Health, which took over the U of M's statewide wastewater surveillance program that has helped with early detection of COVID, flu, and RSV. This year, they began working with a national network that also looks at the measles virus. And in October, a spike in Rochester caught their eye.
What we found in Rochester was a positive finding in wastewater, and we did identify one case shortly after that finding. The peak of the amount of virus that we were finding in the samples went right along with that person's course of illness.
And you found household level data by sampling wastewater for an entire city?
Yeah, if the size of the sewer shed, which is really everybody that contributes to a particular wastewater facility, are between 100 and 200,000 people, you can detect one individual case of some diseases.
That is an incredible amount of specificity.
Mm-hmm. It's groundbreaking work, and it's really kind of cutting-edge technology from a population view, which is what public health is all about.
Meyer says they're now working to expand the measles pilot program statewide.
Still in the validation and testing phases.
One more alert is always useful.
Especially at a time when the most vulnerable are most at risk.
This is really a depressing failure of public sentiment that people aren't as worried about their neighbors and their friends and their relations as it seems like they were in the past.
Now, to catch you up, MDH has confirmed 24 total cases of measles so far this year. There were 70 last year. And the good news is that there is no more virus detected in Rochester or the other 3 wastewater sites in the state. Jana.
Now, Kent, I could be completely wrong here, but measles, the MMR vaccine, I thought you had to get that to go to school. Are we talking about people not in public schools?
There are private schools, charter schools, but there's also the non-medical exemption. So there's medical exemptions where you can say, I don't want my kid to get it because they have medical reason. There's also non-medical exemptions, and those have skyrocketed along with that decreasing rate.
And has that come after COVID, or is it just building year after year?
It's built over the years, but it really dropped off amid COVID. Like I said, Minnesota has the 4th biggest slide since COVID among all states.
Right. Wow. Interesting stuff. Thanks so much, Kent.